Hello, everyone. Welcome to the Infection Control Exchange. I'm your host, Wayne Tucker. And today we're going to be talking about in episode 5 and hygiene. The title is The Foundation That Still Needs Fixing. I think it's a very much an appropriate title because hand hygiene is very much a core part of infection prevention and control, and something that may seem easy to do, but is a pretty complicated issue globally. It's not just something that we deal with in Nova Scotia or Ontario or Alberta. It's an issue that's global. So it's many researchers have investigated the various issues with hand hygiene, and we're going to talk about some of those issues today. So this episode for hand hygiene, it's pretty complicated. Like I said, there's a clinical component, expectation, and there's a reflection of the organizational culture. So there's many things for us to think about in this episode, and we'll talk about many of them. And please ask your questions or post your questions once the episode is posted live, hopefully by Saturday. So when we talk about hand hygiene, we're not just talking about compliance. That's sometimes we often focus a little bit too much on compliance, but really we're talking about culture. And I mentioned that in the previous episode where I talked about the IPAC culture. So every time an healthcare professional performs hand hygiene, it's not a routine step. It's kind of got a statement that they're making in terms of care and safety and respect for both residents and patients and their colleagues or their staff. So join me today as we explore a variety of issues when it comes to hand hygiene. And we're going to break it up into a few segments just to make it a little bit easier to follow along with. And then in the second segment, we're going to talk about why hand hygiene is missed in healthcare settings. So why is it such a complicated issue for everyone, for all healthcare facilities? So there's so many reasons, and every healthcare facility will need to do its own little bit of research and investigation to determine, what are some of the reasons that they're seeing low compliance in their facilities, or whether that's a long-term care home or a hospital. Some of the things are going to be pretty common themes that you might see across a number of healthcare sectors, but there's going to be sometimes some unique things. Every facility is a little bit different, and you're going to see some of those unique reasons why compliance for hand hygiene, for example, is low. So let's take a look at some of them in segment 2 here. So there's a number of human factors and I guess habits that we need to think about. So these are a few of the things that, staff just may forget, or they may be distracted in busy units. So you think about a busy ER or an ICU, or when you're during an outbreak. These are times when staff are doing a number of different things. They got so many priorities, and they actually may unintentionally forget to do hand hygiene sometimes. So because they're focusing and they're on so many different issues to provide care, so sometimes and take care of the patients and the residents. So sometimes they may forget. So that's kind of a human factor. Sometimes when you are in doing a routine behavior sometimes can lead to skip steps. So this is why sometimes checklists are so important. For example, will mention in another episode talking about donning and doffing. You don't want to be memorizing the steps of donning and doffing. You want to be following them exactly as you see in the posters that you have put up when someone's on precautions, and they need to be doing donning and doffing. And within that, it'll tell you when you need to do your hand hygiene as well as when to put it on your PPE. So, but if you get into kind of like an automatic mode where you just, for example, doing a donning and doffing, you're gonna forget steps. So that's why I don't encourage people to all try to memorize it, because when you get into that the routine, sometimes it can lead to skip steps, and we don't want that, because that's going to put yourself at risk, the residents at risk, and your colleagues, staff at risk. So um, sometimes, another issue with you'll see sometimes on the in healthcare is that gloves are sometimes mistaken as substitutes for antigen, and that's not the case at all. It can provide a false sense of security, that you're wearing the gloves, and then you just go around and do your work during your shift, and you don't do hand hygiene because you got gloves on. It's protecting your hands, and that's is not intended and should not be a substitute for hand hygiene throughout your day. So, if you're pushing a wheelchair, for example, there's no reason for you to have gloves on, or some people even double glove. You don't need to be doing that. You got no risk for exposure. Then you don't need to be putting on gloves, or the other PP. So there's times where you'll see people wearing gloves when they shouldn't be. So that's when the staff and the IPAC manager needs to step in and provide the education of why gloves are not needed in that situation. So there's some human factors and habits that people can get into why they may forget to do hand hygiene while working in a healthcare setting. So another one is time pressure and workload. So I kind of referred to it a little bit in the first one, but heavy workloads. I'll use the example again of the ICU and the emergency room as just a couple examples, or during an outbreak in any kind of facilities, the workload increases, and focus where it's important for the focus go where it is, which is to provide the urgent care and take care of the situation. But it's also important, not to be missing the hand hygiene, which only takes 15 seconds, and you can do it pretty quickly, going from one spot to another, even in the ER or the ICU. But it can't skip these steps, because you could transmit something to a vulnerable patient in the ER that came from another infectious patient, or in the emergency room, or in the ICU. So it's not something you can just put to the side during these higher priority or time pressure situations. So you gotta still do it during the situation, and do the hand hygiene, which I just mentioned. It's can be done fairly quickly. So, but we are aware, and infection prevention and control. We're aware that during those times, you know, compliance goes down, right, during the peak activity time. So staff are busy, and you'll see a reduction in the compliance during those time pressure situations when the workload has increased for them. So um, another reason sometimes that should always be looked at is access to the hand hygiene dispensers, for example, and any product issue. So anything that's occurring, with them being empty, which I've seen experienced in my work as well, in healthcare, that sometimes um, the dispensers get emptied, and then someone is not taking the ownership or the responsibility to refill those dispensers. So then you got a situation where staff are busy, and the last thing sometimes they're going to do is go look for a replacement dispenser, or make the call for someone to replace that dispenser with more product. So it's important to that those are replaced in a timely manner. Another thing is sometimes the product and hand hygiene sanitizer is just not located in the right locations. So sometimes there could be some locations where it needs to be, especially when providing care. So it needs to be at the point of care. The dispensers provide easy access, but sometimes some of those are missing, or in a healthcare facility, there's not enough of them throughout the facility. And I think we know, um, based on experience, and I certainly know myself, is that if you don't provide easy access to the hand sanitizer dispensers, then staff are more likely to forget it, or to skip it, I should say. So it's important to make sure that you get all the places covered where it should be, uh, throughout your facility. It doesn't matter where it is, on the floor, in any calm areas or nursing areas, staff lunchrooms, throughout the building. There should be located throughout all floors. So um, there is a degree of education that needs to be provided to staff. So IPAC managers within healthcare, provide that education as part of their work, and often it's part of like an online onboarding process as well, or some annual training and hand hygiene that's done, for example, maybe once a year. So there's that education part that you need to kind of keep continually be working on. So it's not you're not going to do it once; you're going to do it many times, and providing that education and going through the moments of hand hygiene for staff. So, for example, before they enter a resident room, or before they leave a resident room, before doing any procedures, aseptic procedures. So there's a number of times when they got that they need to be doing hand hygiene, and some of that is occurring within the resident's room, and then some of it's occurring outside of a resident room. So it depends. Before you're touching a resident, when they're outside the room, you should be doing your hand hygiene. Um, and after any contact with any resident, no matter where they're in the building, you should be doing hand hygiene. You should be doing hand hygiene after medication passes, and you should be doing hand hygiene during in and out meals and picking up the meals from the table. So there's so many opportunities we need to be doing the hand hygiene. So the knowledge one is something that's going to be always constant. You're going to always be doing education on hand hygiene um, in a facility. So, and then the other thing is sometimes staff like to get the moments of hand hygiene. They're not too uh, knowledgeable about it, so you may need to fix that or provide some education about the moments of hand hygiene. So the other thing is sometimes there's an underestimation of transmission risk. So they might see certain interactions as being low risk as opposed to high risk. So an example would be someone that's COVID-19 positive. Particular staff member might see the importance as being higher in that situation, as opposed to when they were just handing out medication, for example, or just having contact with a resident, for example, in the dining room or in the corridor. So they may not sometimes. They may have their own interpretation that they're giving to certain situations and the risk that goes with it in terms of transmission of infectious diseases. So um, sometimes, as well, like I mentioned, like some staff might be relying on double gloving and thinking, or gloving and thinking that's going to protect them. But that is not going to be the case. The situations where they do need to be putting on gloves, but they always got to do hand hygiene before putting on gloves, and they got to do hand hygiene before taking off those gloves. So, but it's never a substitute for doing hand hygiene. So, but sometimes people get the wrong information from something that they've learned online, or from it could be from a colleague or a staff member. So that's always those things are to me important to be vigilant of in any healthcare facility. So um, the next one is why it's missed. Can be missed in healthcare facilities is that you have to look at the organization and any cultural barrier. So some organizations are going to have a weak IPAC culture, and then some organizations are going to have a much stronger culture. Um, and obviously, the organization with the stronger culture and hygiene is going to be a much bigger priority. There's going to be fewer myths because it's being built up from the frontline staff level, and they are helping one another out with an hygiene. And then, for example, if you see someone missing going to an hygiene, you can remind them saying, "You just realize you've gone into this room on that's on precautions, and you haven't done any an hygiene." But regardless of even if a room wasn't on precautions, you're always supposed to be doing an hygiene before you go into a residence room anyway. So, but sometimes, in terms of the culture, there could be some big culture differences uh, c- um, between facilities. So whether you're working in long-term care or acute care, for example, but also within those facilities, you could see quite big differences between, for example, working on one floor or one unit compared to another area of the hospital. So sometimes even within the organization, there could be big cultural differences between the floors or between units within those healthcare facilities. So it's something that's going to I mentioned in the previous episode that it needs to be built on and built over a number of years, and you need to go through usually a formal process to build a culture and to get it up to a really significant level where things are functioning very well and where it's occurring without anybody observing that it's happening. So it becomes very second nature to the staff to do the hand hygiene. For example, when doing medication passes on their way back from giving medication, they're along the way before they go back to the medication cart, they're doing their hand hygiene, on their way back. So it becomes very much the routine. And by the time they get back to their cart, they've done their hand hygiene and they're starting to work on the medications for their next resident. And the same thing for in and out, any snacks, for example. So it's really important to build that culture and to get that well developed within your facility. Um, so the culture is long term. Takes a long time to build it up, but you can actually it can go right back to a normal or an IPAC culture that's lacking, I should say, fairly quickly. So it could take you years to build it up to something that's really good, and then you could go fall right back to very much a weaker IPAC culture within months. So you certainly don't want to put all this work into it and then for it to go away so quickly when you don't sustain it over a long term. So something you got to be keep working on daily. The other thing to talk about is actually the feedback. So there is feedback that's always provided, during auditing by staff that's working on the floor. It could be audits that's done by people coming in from a ministry to look at compliance, for example. So um, you want to make sure that the staff is getting regular feedback. So, and you don't want it to always be like a performance thing. It's more important for it to help work on building that culture but providing the feedback so staff, but don't focus on providing feedback and doing it all negative. So that's one of the issues in healthcare for a lot of people that working in leadership is that the feedback that staff are given is often all negative, the things they're not doing right. So in this case, if an IPAC manager just approaches a staff member and says, the things that you're not doing with your hand hygiene, it's not a good way to build a culture, and it's not a good learning way for the staff members. So you can still address those issues, but you need to kind of also talk about the positive things that you notice that they're doing. So you need to be approaching it in a more positive manner with staff, talking about the things that you notice that they're doing well. Also mention some of the things that they're not doing well. If you did see someone, that was not responding to that feedback, they're not listening to what you're saying, they're listening to the feedback, but they're not implementing any changes, and you're seeing a pattern on the floor or where they're working, then you might need to bring that to the attention of their reporting manager, a charge nurse, director of care. So sometimes you need to take it to a different level if you're seeing something that's more of a pattern, and they're not listening to the feedback that you're providing to them. So, you know, some of the other things to think about for that might impact why staff might miss and hygiene is just a peer influence. So sometimes, you know, people just follow the examples of others. So a lot of training beyond what a charge nurse might do or part of the orientation process for a new staff. Um, when it comes onto the floor, the staff may pay a lot more attention to what they're seeing. So what their colleagues are doing. What is for example, other nurses are doing, or other RPNs or PSWs. So it might be looking and really focusing on what they're doing. And if they're not doing it, and then they're much less likely to do it themselves. So if a PSW is not doing ANIG when they should be doing ANIG, then more than likely that new staff member is going to get absorbed within that culture of not doing ANIG when they're not seeing their colleagues doing it, or more senior staff, and should know what the proper protocols are doing. So um, sometimes you might get reasons like your staff don't feel like doing hand hygiene in front of patients, don't like performing hand hygiene in front of patients. Um, they may give that reason, but that's not, none of these reasons have much validity to it. So, and I always, when I worked in healthcare, encourage the, residents and patients to remind healthcare staff to do their hand hygiene. So sometimes you gotta be an advocate. A patient and a resident need to be an advocate for themselves and remind healthcare staff who are busy, but sometimes you got to remind them, saying, "Notice you've entered my room here, or whether it's in long term care or in hospital, but you didn't do any hand hygiene." So I try to build that into my information communications to residents, and to empower them to protect themselves as well, right? To remind staff. So we really want staff to be doing it on their own without any reminders, and have that embedded within the culture. So some people, you're gonna deal with this all the time. Sometimes there's a perception that develops within healthcare that hygiene doesn't make a difference, right? And that is not the case. So sometimes it's good within a home to compare, your hygiene compliance rates and stuff like that, and showing staff, and showing reductions in, for example, your infections. So when you see a low compliance rate on, for example, on a particular floor, and then you're seeing and that they've got fewer infections or fewer outbreaks, because they're doing hand hygiene more often, then you need to communicate that to staff on another floor, for example. So sometimes there's a number of things that you can do to improve things. So it's important for the IPAC managers and other leaders to provide that positive reinforcement all the time, right? Anytime they're on the floor, acknowledging that when you're not seeing someone doing hand hygiene, mention that, they've done a great job. If you see anything they're missing, just quickly mention that as well. So, you should just miss a couple of areas there when you're doing it, and do it in a nice and friendly way so that they're um, not taking it in a negative way. So you want to be providing positive reinforcement. And you want to be providing that feedback and that recognition on a daily basis. Um, and it should be kind of non-punitive feedback, unless it was something like I mentioned previously, where you're noticing, particular staff member where they're doing, they're not doing their hand hygiene. You've spoken with them, but they're still failing to listen to the feedback that you give them about their hand hygiene. So in that case, you have to take it to a different level, and have to speak to someone else, like a charge nurse or their direct report. So, but hopefully those situations don't happen very often, and you can deal with it, or provide the positive feedback on the floor, and give them, if any room for improvement, you can just mention that as you go around. But you do need to be present on the floor and providing that feedback. And the more that you're on the floor providing that feedback, the better it is. The more opportunities you get to actually see where those gaps are, and things that need to be improved upon. So um, take every opportunity you can to provide that education through orientation, IPAC orientations, to idles that are occurring on the floor during the shifts. Um, some of it's going to occur through emails as well, or any memos are going out, but I think most of it has to be face-to-face feedback. Like you can do some of that group stuff and group in the huddles that you have on the floors, um, build up that education for staff. So some of the things I've already talked about earlier was to make sure, there's a review done of a few things when it comes to hand hygiene. That could be a barrier. Is that you get the hand hygiene dispensers located throughout the home or in the hospital at the right locations, at the point of care, or as well as in other areas, for example, in staff lunchrooms. And it could be in the chapel. It could be in any area in the corridors. It's on the areas where there's no residents or patients. You still got to make sure that the hand hygiene is there and it's in a convenient location. So Um, and then, just wrapping up this second segment of this podcast on hand hygiene, is you gotta promote that, and it goes back to the IPAC culture. You gotta promote that culture of shared accountability and role modeling. So I mentioned it before. All leaders need to be role models on the floor and doing their hand hygiene. If not, staff are going to notice that, and it certainly goes against building that IPAC culture for hand hygiene. So you want to make sure that you're being a role model when you're on the floor. That goes to anybody that's a healthcare leader or charge nurse. You need to set a good example and do your hand hygiene throughout your shift when you need to. So you also need to promote, that shared responsibility. So, and I've mentioned in a previous episode that um, make it analogous to being to an alpha safety culture, that, it's everybody's responsibility. So when I'm been working in a healthcare facility and walking around, if I see anything that's, paper on the floor or anything, I'm picking it up. Or if there's any spills on the floor, then I'm calling housekeeping to come around, clean that up, putting the warning signs on the floor until it's cleaned up, or sometimes um, taking care of the spill myself. So, there's a number of things you can do to kind of prevent, for example, a fall. So there's a lot of things you can do from a health and safety perspective. So that's how I see infection control in a similar light that we all need to take ownership and accountability and take part in it. So there's no reasons why you should be skipping steps or as a leader, for example, or anybody. We're all part of the process and important to protect the vulnerable residents as well as the patients and the staff. So there's many things to think about in terms of uh, what we need to do for ant hygiene. So in the next segment, I'm just going to kind of talk about probably fairly quickly, but it's ant hygiene is not something that resides in where I'm doing the podcast from Halifax or from Nova Scotia or Ontario, New Brunswick, Alberta. It goes far beyond provincial borders or in Canada. So it's an issue in Canada. It's an issue in the U.S. It's in North America. And there's not many countries where ant hygiene is not a issue. So it's a global challenge that's been there for decades, and I don't think anybody's got it all figured out. But there's certainly countries that are doing much better with it than other countries. It's the same as within Canada. There's probably some provinces doing a much better job with ant hygiene than other provinces. And then drill that down at the level I mentioned earlier. Even within a healthcare facility, some facilities may have one floor that does a really good job with their ant hygiene or very compliant with their ant hygiene. And then you may have a floor that's not doing so well with their ant hygiene. And, so it's a complicated issue, but it's one that we do need to recognize and learn from what's maybe working in other countries and review that and implement and see whether that's something that would work, for example, in Canada. So I think in the research that it's like you can see compliance rates have quite a range. So within countries. So I think some roughly between you can see 40% compliance up to 60% compliance for ant hygiene, and that's low. You want to see compliance much higher than that, preferably in the 90-95% range. So you think about why that's so low for a campaign or for a process that's so important for infection control after decades. So, ant hygiene and the importance of ant hygiene in reducing the transmission of infectious diseases is nothing new. It's been, that knowledge has been there for decades. So, but we're still have a challenge in dealing with it. So, some of the things, I've already talked about, but I do want to talk about some of the common international barriers for ant hygiene. So, um, sometimes in Canada, some of the themes that you'll see would be occurring in other countries as well, like the ones I mentioned, like time pressure, um, just competing priorities, poor access to supplies. There could be issues with skin irritations, a weak IPAC culture. So there could be differences in different countries and low and middle income countries. There could be infrastructure challenges, like some countries have limited access to sinks, uh, inconsistent sanitizer supply, unreliable water systems. So, these amplify those uh, and hygiene issues, whether you use hand sanitizer or soap and water. So sometimes there's complexities that occurring in other countries that are not as relevant for in Canada, but there's still things that you can learn by looking at what's been some of the success in other countries. So the same thing in like higher income countries. There tends to be barriers that you'll see are more like behavioral or cultural. So talking about that, like the normalization of the shortcuts, which I mentioned earlier, sometimes staff are busy, that, they just skip certain things, and that becomes like normalized, something normal. It's okay. You don't need to do that right now. And that might be supported by, your colleagues. It could be, like I said, in the higher income countries, lack of feedback. So, not giving enough feedback to staff. So then they fall back into um, not doing hygiene or not being compliant with hygiene as they should be. So, and the other thing is there could be like weak peer accountability, right? So, it's important for to build in that accountability there and have staff, your peers helping you out. This is goes for anybody, even IPAC managers that are within the facilities. Doesn't matter, they are not perfect, but they should be certainly modeling at a very high level, doing their hand hygiene when they're on the ship, as well as providing education to staff. So, but if they see, as well as like a charge nurse not doing hand hygiene and, an RPN or a director of care, so then what's going to happen is that's that they got very little accountability within the leaders, and then you're going to see low compliance with the staff. So, looking at like some of the major organizations like the WHO, they have their campaign, save lives, clean your hands, and been doing that since 2009. And it's been successful, and as well as the CDC. So there's a number of organizations, not just in the U.S. but globally, that I put in a lot of work into hand hygiene. Some of the other things that, beyond just major organizations like that, that's resulted in some positive changes with healthcare is like COVID-19, which occurred, what's it, 5.5 years ago. That's resulted in some significant changes in some of the province in terms of the protocols, the oversight, the compliance, inspectors coming in to make sure that these homes are doing everything they need to be doing in their infection prevention and control program. So that's so important. And I think, there could be other eyes coming into the facility as well. So those would include, for example, getting a little bit off topic, but like the Ministry of Labor could be coming into a facility to see that, make sure you're doing everything to protect the staff. So, there's a number of people that could be coming in to monitor and hygiene beyond the IPAC manager and the leadership team in a facility. So I think it's, you know, in terms of framing it, like I said, it's not, I just want to provide that kind of some information about, that it's a global challenge, and that it's not just a local one, whether it's within your hospital, um, and that there's a number of things that need to be looked at. So when you're looking at within your and hygiene, that you're looking at it, recognizing that, it's something you're going to be working on within your own facility. There could be some differences across the floors, but, you're not alone with these challenges, because it is very much a bigger issue. And but what we need to be doing is learning from that research that's being done globally, so that we learn from that, and then we can make some changes to some of those things that have worked, and see if we can implement that in healthcare, in, for example, Halifax, or within Nova Scotia as an example. So, NIG compliance, it really is a global issue. It's not a regional shortcoming. It's something that's been around for decades, that most countries are dealing with, whether that's in Halifax, Toronto, London and Ontario in the UK. So there's those root issues, like I talked about: workload, culture, leadership, visibility. behavior reinforcement, providing that feedback to staff, keep most of that positive, but ensure that you're mentioning the areas where it needs to be improved upon um, as well. And, recognizing that, we're trying to protect the uh, vulnerable residents and patients, as well as the staff, and that we all have a role to play. So, like I mentioned, with like health and safety, is not something that's just, you know, we all got to do our part and take accountability and responsibility and be there to help one another. So it's very much like health and safety. We all have a role to play, and that occurs on a day to day basis, every shift. Right? We've got to make sure that we understand that who we're there to protect, and doing everything we can to protect staff. In this next segment, we're going to look at an hygiene technique and duration. So why do staff sometimes go too fast, and why do they miss some areas? So although the alcohol-based hand rub, or the ABHR, should be applied for 15 to 20 seconds, long enough which is long enough for the sanitizer to fully dry and to cover up all areas of your hand. Many healthcare workers finish too quickly or miss key areas. So some of those areas would be thumbs, fingertips, between fingers, back of hands, and wrists. So these misses are, they're rarely intentional. But these are areas that they need to, in the training, we got to educate staff about, so that they become more cognizant of the importance of covering all areas of your hand when you're using the hand sanitizer. So we'll go through a number of, like, I guess, categories or factors related to why some of the technique might be impacted, including the duration. So there's like cognitive and habitual factors. So sometimes the repetition of doing hand hygiene so much becomes kind of an habitual motion. So not really a deliberate one. So staff not really thinking about it. So that familiarity leads staff to believe their technique is already good. So they become very used to doing it so many times throughout the day, and it becomes very much an habit. And then they don't spend any time really thinking about making sure that they're covering all areas of their hand. Sometimes you can look at it as well as like it's almost normalized. So as a shortcut becomes normalized, occurs when rapid technique becomes the group norm. So people just kind of learn that. They're seeing other people doing it fairly quickly, going to the and hygiene dispenser, pumping it, and then doing it very quickly before we go into another room. So they kind of learn that rapid technique from observing other staff. So another category you could look at is just time pressure and performance speed. So the busier, like heavy workload environments, for example, just could be long-term care, it could be an ICU, could be an ER. A heavy workload makes staff rush. So often results in reduced time that they spend doing the hand hygiene, and it might be like 10 seconds or less, right? So you can be certainly be careful, more cognizant of that when you're working in a busy healthcare setting. So where and what happens in those settings, those busy settings, is that the emphasizes speed over precision, because they're so busy trying to do so many other things. They're not really thinking about ensuring that they're doing a good job, a high quality job, or good technique with their hand hygiene. They're just going very fast to get to the next task, and sometimes that can result in being too fast with the hand hygiene and missing areas. So, and what happens actually is, in that time, where these busy times, staff may perceive that 7 or 8 seconds of doing a hand hygiene is actually 15 to 20 seconds, right? Without realizing it at all. So it's important to provide that in education to staff, that even in very busy healthcare environments, you've got to take the time to make sure you do your hand hygiene properly. So So another area is just like sensory and product related issues that may have an impact on the technique and the duration. So I think we've all, um, over the last 5.5 years, used many different kind of uh, hand sanitizer products. So some of those products are, can feel really sticky. And sometimes some of that becomes a sensory issue for some staff that they don't like using a particular product. So you do have to pay attention to the product you're using, and make sure the staff like that product and don't have any issues with it. So another thing in terms of for this, sensory and product related issues is, for example, skin irritation can lead staff to skip or lightly rub certain areas. So you got to make sure again that you've got the right products, and so lotions as well to help with any skin irritation. So that'll help with any sensory or product related issues. So you got to think about what product you're actually picking out, and that's staff are going to use that product, and there's no issues with that product. So um, another area is like training and reinforcement gaps. So technique is often less emphasized than timing or frequency. So sometimes people are focusing a little bit more on timing and frequency than they are on the technique. But it's important that you do the correct amount of time, that you're doing it throughout your shift, but also that you got good technique. If you got poor technique in your hand hygiene, then you're going to increase the chances that you're going to spread pathogens within your health care setting, whether that's acute care, long term care. So you really the technique part of it can't be missed. So uh, another thing is the just like a lack of a visual or peer feedback sometimes means the staff don't really become aware of their missed spots. So that can be covered in whether the IPAC manager or any IPAC champions or any of the leads, charge nurses, to provide some reinforcement to staff on the floor so that they actually get some feedback about how they're doing with their technique, including going too fast or if they're missing areas. So it is important to help one another out. And I mentioned that um, in the IPAC culture from a previous episode, is that we've got to help one another and build that, for example, in this case, the hand hygiene culture, and and look out for one another and just make, if we see any issues with someone's hand hygiene, that we're actually providing them with some feedback in a constructive way. I mean, the whole idea is we're trying to keep everybody safe within the healthcare environment. And if we can help one another out and improve our technique, it's going to help out everyone, the residents, for example, or patients, or any of the healthcare staff. So um, sometimes, like putting up posters can lose its impact because in many facilities, as I'm sure everybody's aware of, like it can come actually like a visual fatigue if you got too much up. Staff just ignore it. So you got to be really careful with those putting up posters, because sometimes you can do it too much, and then what happens is staff don't pay any attention to those posters and that. So another area is like culture and modeling. So the staff are paying attention to, senior staff, the leaders, charge nurses, their fellow coworkers and stuff. So there's various levels to the modeling, but they're looking to other staff and seeing what they're doing. So it's important to be modeling good hand hygiene technique. And I think the visible role modeling on the floors, where staff going to see, the IPAC manager, administrator, an executive director, or charge nurse doing their hand hygiene, then that becomes something that they can that they will model. So the more that they see modeling of good technique, the more likely they're actually going to do it themselves, because they're learning what is the proper way to actually do hand hygiene. So some of the things you can do to help improve the technique and duration is, keep reinforcing in all the education that 15 to 20-second rule, encouraging, counting or, humming a rhyme or singing. So like, something that will encourage them to go to the, like the 15, 20 seconds, right? You can use like UV fluorescent gels or black light training to visualize missed areas. So that's another way to kind of improve it, and make sure that you're, using skin friendly ABHR. So that, because if you don't, then staff are much less likely to actually use it, right? So you got to make sure that you're picking the right product for staff. So another thing is integrating peer observation. So it's important that peers like integrating that into your hygiene program. Positive feedback, can't say enough. You got to be giving staff some positive feedback uh, in a constructive way, but they need to be getting that regular day-to-day feedback when you see them on the floor, and giving them some pointers of things that they can improve them on, but also emphasizing as well some of the areas that they're doing very well. And so you want to make sure there's just feedback, there's positive parts to it, and it's not just all correction of the things that they're not doing quite right. So, and the leadership modeling, I mentioned that, so important for staff to be getting that, you know, modeling from the leaders on the floor. So moving into the next segment, improving and hygiene, like is building those habits are so important, and building those systems as well. So, and the culture. So, and hygiene, I can't say it enough, is like one of the most effective interventions you can use to prevent the spread of infectious diseases. And it takes it doesn't take too long. You got to pay attention to what you're doing so you get full coverage. But, um, prevent that spread of infectious diseases. But achieving, sustained organization-wide compliance, it's going to require more than just audits or education alone, right? So to get that lasting improvement, what I refer to like, building that IPAC, or in this case, hygiene culture, it's going to require looking at, the systems that you have in place, looking at the people that you have working within your facility, and culture, and aligning it so that hygiene becomes an automatic professional reflex, rather than like an enforced policy, right? So you want to make sure that it becomes second nature for them to do it, but to extent where they're doing it well, and not doing it too fast or missing areas. So some of the things like talk about in this segment is hygiene audits and real-time feedback. So observation-based audits, which is very common to use in healthcare, is very much like could be considered like a gold standard, or gold standard, or a cornerstone. So, but their impact, it really depends on on the data that you share. So you need to be providing staff with regular updates and feedback. So real time feedback, so immediate feedback in a non-punitive reminders will reinforce behaviors far more effectively than like a report that's given out every 2 weeks or a monthly report. So you got to get used to providing that real time feedback to staff on the floor, right? You got to be very transparent. It's okay to be posting summary of data, but it shouldn't be the only thing, like I referred to before, about the real time feedback. So it's okay to provide unit level results, and I think doing that on a monthly basis is fine. You can do dashboards or digital monitors or posters. So you can, some places use technology assisted tools, like there's apps and sensors and counters that can be used for hygiene to improve data reliability. But they also got got the pros and cons as well. So when you're doing audits, it's so important to focus on positive reinforcement. So So that staff become partners in the process, like with the anti-hygiene program, rather than the subjects of surveillance. So it's very important that they become embedded in the process. So for an anti-hygiene program. So looking at leadership, visibility, and role modeling, can't say enough about it. Leaders need to be visible on the floor, and you know, engaging with the staff throughout the day as they see staff, and doing it in a very light and friendly way. And that really strongly predicts development of an hygiene culture. So that's a visible presence of the leadership team on the floor, providing that feedback. So then, like the managers, any managers and clinicians who clean hands in view of others. So that other professionals are going to see that, and they're going to model that behavior. And you want them to absorb that. You want to see them improving their technique, but it's important that the managers and the leaders are showing the proper procedures, and so that modeling of that behavior becomes part. Staff pick up on that and start doing that themselves, and improving their technique. Um, so you want to every opportunity, for hygiene and IPAC, is that you want it to be embedding hygiene in everything you can. So I can't say it enough. The more you do it, the more that you will develop that hygiene program, and the better your IPAC measures will be. So you need to be embedding hygiene into safety huddles or huddles on the floors, any briefings, leadership meetings, leadership rounds, all that to kind of normalize and provide feedback about the hygiene as just one example for an IPAC program. So um, next, I just want to touch on a little bit creating a culture of safety and accountability. So you want to move from compliance, which we're so used to. You want to move from compliance to shared ownership. So you really think about that for a second there. You don't want it to be your anti-aging just be all about compliance. So you want staff to get kind of embedded in the process and have ownership um, of the anti-hygiene, in this case, the anti-hygiene program, and ensuring that everybody's doing their anti-hygiene. So like everybody that's working in healthcare, pick your environment, whether it's, an ER or acute care or long-term care setting. So, we're all there to protect patients, residents, and coworkers. So it's so important for staff to understand who they're protecting. So as well as themselves and their families at home. So if they don't do their hand hygiene as well as throughout the day, when they finish their shift, again, they're more likely to bring something home. So there's a lot of people that we're trying to protect in healthcare, and including the staff and their families and friends. So um, it's important I think, to recognize, and we can do that like in uh, at the National Infection Control Week and stuff, to recognize and celebrate units that are showing improvements. So to build morale. So you can create, you can have friendly competitions between floors, but you want to be celebrating and giving a little bit more, recognition to those areas, those floors, those units that are doing a better job with their hand hygiene, for example. And like I said, you can make it a friendly competition between floors and everything. So um, another thing is to improve is developing a culture is just the use of storytelling. So talking about examples of outbreak cases or patients' experiences. So to link the hand hygiene to real outcomes, because that really will make a difference. And staff kind of internalize their efforts in doing and hygiene, as a serious impact on the residents and patients that they're caring for. So they need to feel that what they're doing is gonna make a difference for the vulnerable patients and residents. And the more that they do, and the better the quality of their hand hygiene, and making sure they're not doing it too fast, that's going to have an outcome of having fewer outbreaks, less residents or patients, for example, get infected with infectious diseases, for example. So it's important for them to kind of see that there's real consequences in a positive way, and so that, and as well as from to understand, there's serious consequences for vulnerable residents and patients getting sick. So which could be lead in some cases to death. So you need to build an hygiene into your onboarding process. So anybody that comes in new into the facility needs to receive some training, preferably by the IPAC manager, and that you will, that you have discussions with them, the new staff or anybody returning, so you could so that you can build that consistency as much as you can, and starting that right from when new staff are starting. So another area is accessibility, environment, and product quality. So just touch on a couple, but you need to ensure that the dispensers, and I mentioned it in this episode, that the anti dispensers are located at the point of care and that they're refilled on a consistent basis. So you don't want, um, you know, dispensers at the point of care or even in the corridors, and they're not being filled up in a timely manner. So as soon as that's empty, someone should be replacing that so that that dispenser is available for someone to be using next time, and they don't go to that dispenser and then find out that it's empty. So another thing is, like I mentioned earlier, is choosing a skin-friendly, fast drying ABHR to increase comfort. So because if you have a product the staff doesn't like, or it's too slow to dry, but I think most of the alcohol-based and rub dries fairly quickly, but allows you to do your and cover all areas of your and within like the 15 to 20 seconds. So education, I want to talk about education and skill reinforcement. So you need to be supplementing, annual training for hand hygiene with interactive demonstrations. So you can use like the UV gel and have a simulation. You make sure you're using like micro learning videos or anything that's like a quick refresher for staff to kind of learn, reinforce and learn, I guess, their technique that they're using. So for some staff, we'll find out that they're doing everything correctly, and then for other staff, they'll learn that they need to make some changes to the way they're doing hand hygiene. So very important to link hand hygiene performance to infection data to reinforce the relevance. So staff need to know that it's having an impact. So in terms of like looking at behavioral and system integration, you need to make sure that you align your hand hygiene improvement with organizational quality and safety frameworks. You need to make sure apply like you can use cues and routines and rewards to strengthen habits. So, like I said, you can have contests on your floor, not only for infection control week, but you can do that on a regular basis and have contests where there's a prize or something, once a month, once every quarter, something, that can strengthen those habits of doing hand hygiene, having good hand hygiene technique, make sure they're not going too fast. So hand hygiene is like, improving hand hygiene requires more than just like reminders. That's not enough by itself. It demands you to build a cultural shift that's going to be supported by leadership. That's very important. It's provided by the environment. So in terms of where the dispensers are and everything like that, and there's behavioral reinforcement to staff on a regular basis from the leadership team, their coworkers, charge nurse. So by combining effective audits, visible leadership, accessible products, positive feedback, organizations can transform like an hand hygiene from a compliance metric, so looking just strictly from a compliance metric perspective, into a daily act of professionalism. So for reducing transmission, protecting patients, and strengthening infection prevention resilience. So in the last segment, it's just a summary, um, of this episode. So, you know, to go from like for anti-hygiene improvement to you go from knowledge to culture, right? Anti-hygiene needs to be consistent, needs to be high quality. You need to have high quality compliance, um, but not having that. So if you're not consistent, and you don't, you got low compliance, then it's going to continue to challenge healthcare systems around the world. So, in this episode, highlighting that anti-hygiene success depends not only on awareness, so it's not enough just to be aware of it, but it also depends on behavioral consistency, the environmental design, leadership modeling, and organizational culture. So, final message here is improving hygiene should not be looked at as just a campaign. Sometimes it is, but you can't look at it strictly as a campaign. It is a continuous cultural movement that you got to think of from that perspective that connects, every clinician, social worker, anybody working nursing staff, support staff, leaders in regards to patient safety. So you got to build that cultural movement. So when organizations combine strong systems, supportive leadership, and human-centered design, and hygiene becomes part of your process day to day, and it's something that we need to really think about. That's why this episode is a little bit longer than some of the other episodes, but for hygiene, there's just so much to cover, and I wanted to kind of cover as much as I can in this episode, and I might do a future episode to talk about other components, but this is why this episode is particularly long. But in closing, to wrap up this episode, you want to think about hygiene shifts from something we must do or to something we must always do. So I just want to repeat that. Just think about it, the difference, right? So you want to make that shift where staff is just from something we must do. So something that they thinks about, well, I must do hygiene here, I must do it there. You want to shift from that to something we always do. And thank you for listening to this episode for hygiene. And please share the links for this episode on your various social platforms. And I'll be working on the next episode pretty soon. And I'll be thinking probably very much in this near future, a couple weeks or so, I'll be moving from doing the audio podcast to doing video podcasts. So I'm going to be doing some of those, and then I'm going to be starting with having guests on the show. So thank you very much for listening today. My name is Wayne Tucker, and I'm